Hey everyone, my name is Dr. John Birch. You guys have probably been wondering who I am just a little bit, answering all these questions about you guys having plantar fasciitis issues, basically going to a bunch of different providers, physical therapists, chiropractors, podiatrists, and just basically every provider in between, trying to get some information just to help you live your life so you're not constantly having foot pain. And so what I'm going to do in this video is I'm just going to describe to you a little bit. You can read in my messages too, but I'm just going to describe a little bit of what plantar fasciitis is and just some simple exercises, treatments that might help you out. Along this video, this is not diagnostic, this is not a treatment plan. These are just some things that have helped me out in the past, have helped my patients out, and that might potentially help you out. If you decide to do any of these activities and you have any issues, please just go to your primary care, talk to them, one, about if you should be doing the activity, if it's going to cause you any benefit, or just anything else like that. It doesn't have to be a primary care, it could be a physical therapist or chiropractor to just get to a provider in person. All right. And so whenever we were talking a little bit earlier about plantar fasciitis, we were talking about just chronic inflammation and chronic pain. Unless there's a traumatic injury that caused significant tears in the plantar fascia or just anything else like that, majority of plantar fasciitis and foot pain is just chronic issue, which is meaning it's day-to-day things that cause you your major issues. For instance, let's just think about it. If you're having any type of foot issues, let's say you walk 5,000 steps a day, multiply that by 7 days a week, multiply that by 4 weeks in a month, and then multiply that by 12 months in a year, and then maybe even multiply that by years, just to depending how long you've been having this issue. And every one of those steps just keeps re-aggravating that plantar fascia. I wish I could tell you plantar fasciitis, there's a very cut, clear, easy way to treat it, but unfortunately there is not. Since it's usually a chronic issue that people have to deal with day in and day out, it's going to be day in and day out management that's going to help you get the results that you truthfully need. All right, just a little bit more about plantar fasciitis. I know Mr. Shepard reached out to me and asked if I could comment a little bit about if the plantar fasciitis issue is not coming from the foot or the ankle area. And so basically, if you're going to any provider with lower extremity issues, you're gonna have the provider do a full lower extremity evaluation. For example, they need to check out the hips, hip flexors, glutes, IT band. They need to check out the quads. They need to check out the hamstring, the groin muscles. They need to check out the tibialis anterior muscles in the shin. They need to check out the gastro and the soleus in the back and all of those joints too. Just because some of the plantar fasciitis issue could be coming from an upper chain area, let's say from the hips, or the glutes, or the hamstrings, or even the quads. And so for that case, your provider will have to just do a full screen of that lower extremity, because as you know, the whole body is connected between the skeletal system, the muscular system, the nervous system, and just everything else in between. And so let's just say you have such a tight muscle that's causing your body to compensate and have to change your walking, not having the right length of stride, just because, for instance, let's say your hip flexor is so tight. One of the benefits from that, and Mr. Shepard wanted me to talk about, was doing some dry needling. Dry needling is very great in reducing that muscle tension. Okay, some people don't like needles. Me, preferably, I needle people all day long, but I don't like getting needled. So I usually needle patients or get needled when I truly need to. In majority of your guys' cases, you might need to get some kind of therapeutic exercise or therapeutic modalities, or even a therapeutic treatment in there, whether if it's acupuncture, dry needling, hands-on manual therapy, or just anything in between. And so let's move back down a little bit to the foot more. I'm just going to give you some simple exercises today that you could potentially start off with if you're having some foot issues. I would start off with this because if I'm having these kind of foot issues, I want to make sure I address it ASAP. All right, so some of the basic things that we're going to be doing is we need to stretch out the Achilles tendon and also the calf. The main reason is because those muscles are responsible for that plantar flexion of the foot. And so if these muscles and these tendons are super tight, it's going to cause that plantar fascia to still be significantly tight. And so what we want to do is we want to do dorsiflexion, this movement exercise, to reduce some of the muscle tension. Whether if that's just kneeling on the ground right here, kneeling into this dorsiflex motion, you can do that. I can come up into to the wall. Make sure it's not a wall that you don't want to scuff up, or take off your shoes, just because I've had a lot of patients have issues with this. Just put your foot up against the wall in the dorsiflexion motion and just slightly lean into it. You'll feel that Achilles tendon stretch. You'll feel that calf muscle stretch too, okay? If you need to be a little bit more aggressive, like you've been doing those all the time and you're just not getting relief, we just need to actually break down that plantar fascia and reduce the muscle tension. And so some people out there like hands-on massage therapy in there. Some people are too ticklish in the foot, so they don't like that. Some people like getting needled to reduce that muscle tension. A lot of people don't like that too. And so what can you do to reduce that muscle tension in that foot? What I would highly recommend is just foam rolling for the foot. Foam rolling for the foot is really, really simple. And honestly, you probably have all the equipment you need to do at home to do this. For instance, right now, I'm using a little weight because we don't have any balls in the office. And so you can change this up with whatever you have at home. And I would highly recommend using the stuff that you have at home so you can save some money and save some time. And so what I would recommend is starting off with a tennis ball. If any of you have dogs out there, you probably have tennis balls. You can start off with a tennis ball, you can start off with a softball or a baseball. The main reason I want to start off with a bigger ball is because we want to roll that plantar fascia up and down on that ball. Start off with a bigger ball so it's less tender. Let's say if you want to progress and you just want to get a deeper stretch, or a deeper compression to reduce that muscle tension or that fascia tension, I would recommend moving to a golf ball. The reason why I don't have patients start with that is because the golf balls are small and they're so pinpoint that it's going to cause patients a little bit of aggravation. And whether you're doing the stretches, whether you're doing the foam rolling, or what I like to call ball rolling for the foot, only go to your extent. If you're taking yourself to that pain level every single day, you're just gonna cause flare up, you're just gonna cause inflammation of that plantar fascia, okay? And so what I highly recommend is just implementing slight stretches, slight ball rolling for the bottom of the foot every day, because you gotta overcompensate how many steps you're taking on a daily basis to reduce the amount of strain and the amount of inflammation on that plantar fascia. And so I wish I could say, hey, this is gonna be just the most simplest and this is gonna go super quickly, but you're gonna have to work with this just with anything else good in life you wanna do. For instance, repetition is the father of learning. So you gotta give your foot positive repetition, and you gotta work on both sides. If you only work on one side, most likely you're gonna get overcompensating issues, okay? And then let's say if that plantar fascia is just really aggravated and causing you a lot of pain, just take a step back and ice that foot. We need to reduce the pain and inflammation, and one of the most simplest, easiest way to do that is just icing the foot. It's not gonna be fun. I'm not a big fan of icing personally because it's cold and it's not fun, but the therapeutic benefit is gonna be tremendous to reduce that inflammation and reduce that pain around the plantar fascia. After that, after you're done icing, get on the ground, do some stretches, do some ball rolling, and just help yourself out. I know I covered a very broad topic right now, but I'm fully expecting you guys to just give me some comments about, hey, can you dig into this area a little bit more? And I am more welcome to do that. I'm also gonna be doing some reviews over some products out there, because if you look on Amazon, Google, or just anywhere you go, there's a million different products out there. And you're like, what's really going to be doing the therapeutic benefit for me, what's going to be worth my money, what's going to be worth my time. And so in the near future, I will be doing my own product reviews, just as if I was buying it myself, so you guys don't have to waste the heartache, the money, and the time buying something that is not going to be doing the right thing for you. And so, since I've been getting a lot of love, which thank you guys for reaching out to me about all these tremendous questions, we all have a certain amount of time in our day. And so what I'm gonna do is people who comment on this video and ask a little bit more thorough questions about it, I will dig in and make a new video once a week by people commenting on this video. And the main thing is, like other people's comments if it refers similarly to you, or just add a little bit more detail to it, and then I can address that in the future. The sad thing is I just don't have enough time in my day working and giving you guys some free advice to be able to do all of this. And so if you could work with me, I'll work with you. Thank you guys so much. I hope this helps. And if you need anything else, please let me know.